Again, Brian Meisner, our Emergency Management Coordinator, joined by Ms. Case Miller, our Deputy Coordinator. So we have a few slides that we'll go through with you with some of the key data points that you're interested in, and then we'll be happy to answer any questions you have. So as per usual, here's the update of where we are at with our 7-day moving average of testing. We're currently at 11.1%, which continues to be a downward trend. So this is encouraging to see that trend. However, it's still not anywhere close to being down to zero, and we've got many months ahead of us, which is why it's important that everybody still maintains the practices of watching their distance from others, wearing a mask, washing their hands, trying to avoid those large groups and gatherings, and teleworking from home whenever you can. In terms of our testing task force, 2 quick notes to pass along. Due to some challenges both with logistics caused by the weather, as well as a 60% decrease in demand over the last month, we have reduced our testing events from 11 sites down to 7 sites per week. The same number of 200 tests per day is still available, but we routinely have not reached that on a daily basis, and we are still reaching each of the existing sites once a week, so there is still plenty of testing capacity available excuse me, in the community that we're providing through our testing task force. This is the graph that shows vaccine distribution phases. It's the same as last week. The Commonwealth is in 1B. This health district is currently serving groups 1, 2, and 3 under 1B, as well as persons who are 75 years or older, 65 years or older, and 16 to 64 with a pre-existing medical condition, as well as persons who live in homeless shelters or correctional facilities. I will note that from a VDH call-in data today, they have consistently reemphasized that due to the volume of folks in the Commonwealth who are in 1B and the amount of vaccine that's coming in from the federal government, it will likely be until March or April, if not later, until everyone who's eligible and willing to be vaccinated in Phase 1B is able to be vaccinated across the Commonwealth. The next few slides, we want to just briefly touch on the state dashboard to make sure that everyone understands the different data points that the state is currently providing for us. This is the top header of the dashboard, and it shows 3 different things. So the cumulative number of doses received is from the Federal Long-Term Care Facility Program. So that's the contract with CVS and Walgreens, where they're going into nursing homes, assisted living facilities, and other congregate care settings. It shows the doses that are part of the Virginia vaccination program, and it divides both first and second doses for the Virginia data. Unfortunately, the data that's being reported on the dashboard from the Federal Long-Term Care Program is in the aggregate, so it is both first and second doses. And I'll also note that these percentages combined for the total number of doses received will equal 200%. So it's 100% of first doses and 100% of second doses administered would be the data to show 100% administration for both those items. So with that, these are 3 snapshots of parts of the dashboard that show us how we get to that number of 1.6 million. So the Federal Long-Term Care Program has 178,000 doses through that program. The number of first doses through the Commonwealth's program is 915,000, and the number of second doses is 515,000, which equals that 1.609 million number that we showed a moment ago. The breakdown for first and second doses is what I'll spend a few moments on next, and I do want to specifically call out the very small little asterisk that the state has on their dashboard on first doses. So the doses that are received by hospitals and health districts are the gray and blue. And if you'll notice, there are more doses administered by medical practices, other community health providers, and pharmacies than they've actually received. And that's because in many cases, the hospitals and the health districts were the original recipient of a dose, and then they underwent a reallocation process to make that dose available to be administered by a medical practice, community health provider, or pharmacy. So the state health department is tracking who they allocate doses to, but the actual administration comes from that Virginia Immunization Information System. So they're still working on that data gap at the state level of how do they close that from when a reallocation occurs, how do they shift that allocation on this chart back to the place where the dose was actually administered. So that has caused some confusion in some of the questions we've seen come from constituents here over the last several days. And then on the second doses, you can see that there's much more work to do. The districts just began receiving Moderna second doses on the 18th of January, and next week is this district's week where the full 2,000 plus capacity week at Beacon is ready for their second doses. So the amount that our district has done thus far have been those smaller clinics that originally started out with the 1A healthcare providers. This is another segment of the dashboard, and I want to note and focus very specifically on the title. It is by the locality of residence. So the previous data is based on what was given to hospitals, local health departments, and practices based on a health district. However, this is based on where the person lives. And so it does also include the federal long-term care numbers in here. The footnote at the bottom is that there are 133,000 doses that are not mapped, either because there wasn't location data in the Virginia system, or they may have been out-of-state essential workers who were eligible to be vaccinated in the state, for example. And so the key point is that of our residents, the folks that live in this health district, 41,439 doses have been administered. Of those, 7,229 are fully vaccinated, meaning they've had both their first and second dose. So now for some updates about the health district's vaccine inventory and their clinic plans. As of Saturday 2/6, and I'll note that this is consistent throughout all this data, they're going to be taking a calendar week approach, so from a Sunday to a Saturday. As of Saturday 2/6, they had received 8,775 doses of the Pfizer vaccine, 100% of which has been transferred out. So they have not personally administered any of that vaccine. For the Moderna, there has been a total of 20,650 Moderna doses received. The number that have been administered by the health district or transferred out to partners is 15,090. And I'll specifically highlight that for the week of 2/1 ending 2/6, just at health district clinics that were being served either from the VAMS bookings that were already on the books or from the wait list, there were 4,061 doses administered by the health district in a health district clinic. So that brings us to the inventory. So at the end of the week on 2/6, with the beginning inventory for the week of 2/8, they had 5,560 doses on hand. That is largely because of the surge of second doses they received last week from the specific allocation for that purpose. There was a shipment received yesterday of 3,600 Moderna doses, leaving a total inventory to start the week with yesterday's clinic numbers of 9,160 doses. For the capacity that is scheduled on the books this week, we're looking at 5,160 appointments available, and the vast majority of those are fully booked as of this briefing. We'll be finalizing that to make sure if there are any holes, we can go ahead and plug them. So there is still a little bit of a delta there. However, that is because shipments arrive in the Monday to Tuesday range, so there does have to be some inventory for next Monday and Tuesday's appointments, plus a small buffer, and a portion of those doses are second doses that cannot be reallocated as a first dose. So some of those necessarily will need to sit to make sure that they can be accommodated for the person who is due a second dose. For the waitlist and call center, we know that there's also a lot of concern and frustration for people wanting to know where they're at on the waitlist. We are able to give an overall summary of the list at this point in time. So we are currently at 48,899 people in the health district who are on the waitlist as a first dose. That number was as of yesterday, the 8th. Of those, 1,232 have been scheduled off of that waitlist for a confirmed appointment. We also are assisting with their second dose pre-registration process, and so there are 8,832 folks pre-registered for a second dose because of those challenges with the VAM system, and of those, 423 have been scheduled. So that is the waitlist data, and in terms of the call center process that Mr. Martino mentioned, we are fully staffed up there now. The library team has been doing an amazing job, as well as some of our other agencies and departments that have stepped in well over a month ago, from social services, elections, Parks and Recreation. A bunch of different team members have jumped in here. So that surge of capacity is what got that schedule booked out full to make sure that we don't have any appointments that are gaps moving forward. So again, just to iterate that if you have a Prince William Health District waitlist ID number, you're on the list. We're exploring some ways to be more proactive in communication to those folks with the health district, and be happy to answer questions at the end if there are more specific questions about the wait list. For our planning assumptions, we continue to support the health district in their planning efforts for 2 clinic sites, one on the east side, one on the west side. We're currently finalizing the locations of clinics for the week of the 15th. We know there have been many questions, especially as of this morning, that have come in about the CVS program. I'll briefly note that that is a federal program initiated by the new administration. There is a separate allocation that the federal government is giving that program, so it does not come out of the Commonwealth's allocation or this health district's allocation. There is one location in the county. It is in Gainesville. And you do have to go directly to the CVS website to register. Apologize, but it actually hyperlinked here. So we'll make sure the link gets out through our public information channels and to the members of the board. You are required to state that you're 65 or older and that you've already been on a wait list. So the number one thing that they are at least trying to help with is encouraging folks that they still need to be on the local health district wait list. And I'm unsure of exactly that process of how they're handling that, but they are working closely with the state officials to be a good partner in bringing that capacity into the Commonwealth. We are continuing the partnership with Safeway at Veterans Park in the health district. They are booking exclusively off the wait list, and those appointments have routinely been full. And then that manual booking process that Mr. Martino mentioned is what we're supporting with the call center to fill any appointment slots that are unfilled with these booking processes. So just to reiterate, vaccine is still only one tool to help stop the spread of COVID-19. It takes all of us as a whole community effort. So make sure you're watching your distance, wearing a mask, washing your hands, avoiding crowded places when you can, and teleworking when you're able. A quick note that the link is here. Again, sorry it linked itself, but for folks who are interested in joining the Prince William Medical Reserve Corps, the direct web address is vdh.virginia.gov/Prince William MRC. And those are the team members who are able to both do clinical roles, and then they also need lots of non-clinical support as well at our clinic sites.
On the online PowerPoint, it's showing that there's so people can follow.
That's okay. Thank you very much. So, and with that, I'd be happy to answer any questions.
Thank you very much, Mr. Meisner. I'll go to Supervisor Franklin, then Supervisor Bodie, and
Sure.
then Supervisor Bailey.
Just so that I'm clear, there are 20,650 vaccines that Prince William County has received?
Supervisor Franklin, that's the number total of Moderna vaccine. So the total number that the health district has received is 8,775 Pfizer, and then the 20,000 is the Moderna doses.
So about 28,000, maybe 30?
Yes, ma'am.
Okay, so 30,000 for Prince William County thus far, roughly.
For the health district.
For the health district.
That is only one of the categories on the 5 categories on the state dashboard. So that does not include what was originally sent directly to the hospitals early in the event. Does not include what was directly shipped to some of the other providers. From the dashboard number, I believe 58,500 is what has been received by any of the 5 provider types inside this district. But the health district only has control of and can only speak over those 8,775 Pfizer and 20,650 Moderna doses that they directly received.
Gotcha. So the health district, which this locality is working directly with to vaccinate our residents, they've gotten roughly 28,000.
Yes, ma'am.
Okay, without those separate entities that are kind of doing their own thing.
It's not that they were doing their own thing, it's that the Commonwealth's allocation strategy changed now 3 weeks ago, so they were eligible to receive vaccine directly from the Commonwealth prior to that change in allocation where everything had to come through the health district.
And did you say that that was roughly 58,000?
58,000, and I believe it was 500. I can check the exact number after the presentation and get it for you.
Okay, just so that we're clear when residents ask us, so that we can make that, that we can differentiate between the health district, which we're responsible for, as opposed to other entities,
Yes, ma'am.
I should say.
Understand.
And then with regards to CVS, and you may not be able to answer this, but you mentioned that that was more so of a state and federal partnership. And so the locality, Prince William, we don't have anything to do with that.
That's correct. So it was a federal program, and our understanding is that the VDH headquarters level folks use some of the health equity data that the governor's office in VDEM has to make selections for how those sites were chosen. And we're not aware of any feedback that was solicited from our health district, and we were not asked for any feedback in the selection of that site.
Okay, is that something that we can look into as to why we haven't been?
We're certainly happy to send the question up the chain, and we'll let you know what response we get.
Yeah, Mr. Martino, I would like for that to be answered in terms of exactly which equity data. I'm fine with where the current site is, but obviously it would be nice to have some type of partnership on the east side and maybe even mid-county as well. Obviously, it's CVS. They can put sites wherever they want, but just curious as to what equity data they're using. So if we can just get that answer, that would be great.
Yes, ma'am.
And I think those are all my questions. Thank you.
Supervisor Bodie?
Thank you, Madam Chair. Thank you, Mr. Meisner, as always. You touched upon a little bit that you guys are looking into more ways to communicate with constituents, because that's something that a lot of folks have been coming to me about in my office, that frankly, they sign up and then they don't hear anything. And, you know, in some cases, they could just be a few days, but sometimes they feel like it's been weeks and they don't hear anything. So one of my questions is, since one of the biggest things that you all have been collecting since almost day one is email addresses for a lot of folks, is there any way to start sending out regular emails, at least to tell people, not only just on what you cover with us, but just in general, you know, hey, this is where we are in terms of our progress. Here's where people can expect. I mean, even just the data you shared, where by April or by June, this number of people will be vaccinated by our projections. Is that possible?
So thanks, Supervisor Bodie, for the question. From a technology standpoint, yes, we're looking at the ways to support that. We have a planning meeting with our colleagues in the health district and the cities later this evening to talk in more detail about how that would be implemented. So I'd like to speak with them and make sure we kind of confirm details before we commit to anything. But we are actively looking at that. And we understand the frustration that some folks have that they haven't heard anything for a little while.
Sure. And to piggyback off of Supervisor Franklin's questions and comments, you know, I'm already getting emails and people who are frustrated with the CVS because, frankly, it's another situation where someone else came in from the outside and started offering something that was slightly different from us. And it makes us all look like we don't know what's going on. And frankly, I get that, you know, they didn't communicate. And that's an issue. I guess my main questions are one, it looks like they're sort of working on the wait list, but sort of not. You mentioned that they are at least asking if folks are on the wait list as far as their criteria. Can you dive into that at all anymore?
The only quick bullet I can offer from an understanding is that if you say you're not on a wait list, they're going to ask you to please go join your wait list because there are folks who have been on a wait list waiting. And part of what the state will be doing as they look to merge all of the wait lists up at the state level is to also reference who has been immunized in that VIIS system and help pull those wait list records collectively off of all of our books. So my understanding is that is something that the state specifically requested of CVS as part of the partnership, but we'll have to confirm that with them more formally for you for the next presentation.
Sure. And in terms of that, since it's only, at least in Prince William's concern, a Gainesville area that's being, I've heard some constituents have been able to go on a CVS website and see other locations. Do we know of anything else like that coming down the pipeline in terms of CVS or any of the other private pharmacies?
So the CVS site for the federal program does show all participating locations. My understanding is there are no restrictions for which site you can go to. So if you chose to pick another site further away to drive to, my understanding is they'll still accommodate the booking. But we need to get more details. The full public details have been a 2 or 3 sentence, 3 paragraph press release about the program today. So we'd like to bring some more information back to you once we get some more concrete answers from our colleagues at the state.
Sure. And my last question, and again, I understand that you guys can't see behind the veil too much with this, is what happens if there's a no-show or there's a gap there like you mentioned? Because it seems to me like if they aren't directly working from the wait list, you have a possibility where someone might get their first dose somewhere else, get their second dose CVS, or vice versa. You know, what if someone doesn't show up for their booking? Do we have any way of at least collaborating with them on if those gaps appear?
We'll ask the question. Just generally, any partner that is receiving vaccine has to have a plan in place for ensuring there's no wastage. Generally, that is within their existing employee base, whether it's other pharmacists or healthcare providers who perhaps haven't been vaccinated yet, and if there's an extra dose at the end of the day, one of those providers who is already eligible and perhaps overdue would get that dose. But we'll ask the specific question and see what can be shared about their plan. But just generally, we've not heard concerns of wastage occurring at all, and there have always been plans in place with the providers. And it is on that specific provider to make sure they have a plan in place. For the providers that we're working with through the health district, so Safeway at Veterans Park, and just the health district generally, we have that interactive conversation to make sure that if they find themselves in that position to immediately let the health district know so we can work with them for folks off the wait list.
I appreciate
that would not apply to the CVS situation at this time because it's a federal program.
I appreciate that because we prepped our way up to, I think we're in the top 10 now in terms of states, in terms of vaccinations, but I've heard other states where they've had that issue since there's not a unified wait list. So with some of these providers coming in, they've had wastages, they've had people who have frankly, not who've fallen through the cracks, and you end up with the diminishing returns on second dosages and all these other issues we've heard about. I just want to make sure people know that it's something that we need to be concerned about. Thank you.
Thanks.
Supervisor Bailey.
Thank you, Madam Chair. Brian, thank you for your presentation. I wanted to ask again, in terms, I was on a call yesterday in terms of the localities of where we're distributing the vaccines, and it was said by the governor that we can utilize other localities. And so I guess my question to you is, I know that in certain parts, especially on the Eastern Corridor, we do have other localities that we can utilize to distribute the vaccine. So is there an avenue that we can partner with the VDH to make that happen? And I'm specifically referring to the seniors. I'm really concerned about, because that's where most of my calls are coming from. And so I know that we have a heavy population on the Eastern Corridor of senior citizens. And so my thing is, if we have churches or we have rec centers that we've been successful at doing the testing, is that a possibility that we can work with our partners with BDH to give the vaccine as well?
So we definitely understand the request and what you're asking for. From what the health director has told us, given the fact that supply is still relatively constrained, we're still looking at an average of 3,000 Moderna doses coming in. So there's more of that coming in, but some of that's the Pfizer allocation. So we're looking at about 3,000 Moderna doses that come in. They are telling us that at this point in time in the response, they need to hold to 1 or 2 fixed sites maximum. There is a lot of setup and support in terms of what's required for a site, and it's very difficult to go here one day, go here the next day at this particular point in time because of the post-vaccination monitoring, because of the fact we need to have positive control of every person that comes through for a first dose to ensure we pre-register them for their second dose. They have told us that that is absolutely something that as more vaccine becomes available and as different vaccine candidates, specifically those that are 1 dose, become available, that is hopefully where we can focus some of those efforts. But from what we have been told, they would like to stick with the 2 main sites for the time being, 1 east, 1 west. We will continue to reiterate the request with them and talk through that process.
So, okay, I understood perfectly what you just said, but in terms of expediting the process, do we have any leverage in terms of talking with them to determine once we get the vaccine in, that could be expedited a little bit faster when you talk about the March-April timeframe?
So I would just say generally in terms of our planning process, we're always looking forward. Once we know that we're a couple weeks away from another vaccine candidate that's a single dose, and the Richmond side of VDH can give them some quantification of what that looks like, then they'll be in a better position to talk about what type or size of clinic they would like to do. FEMA has actually recently released some typing standards, and that's something we use in the profession of type 1 up through generally type 6, anywhere from fire engines to mass care shelter support teams. So we're going to adopt that typing and work with our colleagues to talk about the size of site and the number of doses per day. So we will absolutely lean forward. We absolutely understand the request. They're just telling us right now that given they're averaging about 3,000 Moderna doses, they'd like to hold to the 2 sites.
And that's only for the Moderna, that's not for the Pfizer, that's just for Moderna?
That's correct. That's just for the Moderna. The Pfizer's currently 100% being transferred out through the partnership with Novant for the educational staff.
Okay, thank you.
Yes,
Mr. Martino.
Thank you, Madam Chair. And following up on Supervisor Bailey's question, this is different from the testing that we've done, and we were able to pick up and move on a daily basis. So it's a little bit more involved, more difficult. We do have sites, as we shared at one of our prior briefings, quite a few sites that we're ready to scale up to, and that's where we need the vaccine supply. But we are also in daily conversations with the health district and just about daily with the region and talking with my counterparts throughout Northern Virginia. And everyone's facing the similar desire to do more quickly. That's kind of where we are. Thanks.
Supervisor Lawson, then Supervisor Vega.
Thank you. So Brian, as far as the pharmacies, is it only through the federal program? Or, because I thought that we were talking about pharmacies a week or 2 ago that were not tied to the Fed program.
Yeah, so let me break it down 2 different ways. The recent CVS announcement is part of the federal program. We know that Walgreens is also part of that same program. We don't know what the details are about how soon they'll also begin.
Does that mean that Walgreens will be announcing a location soon, or what do you mean by that?
Walgreens is also in the same federal program. We don't know what date they're starting, similar to the fact that CVS has announced. But so Walgreens is coming online in that federal program as well.
Okay.
In terms of what's occurred in the district, the Safeway has partnered with the district to operate the Veterans Park pod site. And that
Okay.
was at their specific request because most of their stores didn't have adequate space for the post-vaccination monitoring. And it was their preference to work with a district, pick a single site, and give their clinical capacity to the district to assist in moving folks off the wait list through that site. As part of the Commonwealth distribution strategy, both prior to the change in allocation late January and still to date, if there are specific pharmacy partners that the district essentially nominated to receive vaccine or felt were good to partner with, they could have either specified those allocations or make redistributions. So there was one pharmacy partner that they did that with. Our understanding is that given the current appointment availability and the need to focus at the 2 clinic sites, that there have not been any of those reallocations to other pharmacy partners this week. So the only partner is Safeway for the fixed pod site based off of the wait list.
Okay, is there a likelihood that we're going to see Walgreens announce 5 locations in the county, or am I being really hopeful?
I'm not sure, ma'am.
You don't wanna
dependent
say.
on, we've not received any information other than the press release from the White House that CVS and Walgreens were participating in that program.
Okay.
Is all we have.
Okay, because as you've been presenting, we got a blistering email from a very disgruntled, understandably so, Prince William County resident that was sent to the board about, CVS chose one location in this huge county. And I understand her frustration, which none of us in this room, are responsible for and frankly can't change, but that's the reality of what we're facing.
Can you clarify, Mr. Meiser, whether CVS chose that location? I think that's not correct.
So we're not 100% sure of how much of this was federal decision, state VDH Richmond decision. We know there's only 35 CVS locations in the entire Commonwealth, and the amount that they have nationally is selected by the federal government.
If I said CVS, I meant the federal. What I do know is none of us chose this location.
Yes, ma'am.
And chose only one CVS in the county.
That's correct. It's a federal program. There was some sounds like brief consultation with the state level officials
Yeah.
to try to at least help improve the fact of acknowledging we all have wait lists we're trying to work
Right.
off of, but it's a federal program.
But we don't know whether it was a joint decision by the federal program and CVS but.
We're going to have to check and try to bring the answer back
Yeah.
for you.
So, thank you for that clarification on the pharmacies. And then the last question is, a few weeks ago, Dr. Ansher was updating us, and she was talking, when there was so much frustration with the VAMs and folks had to have an email address, what if people don't have email, especially, the older population? She started to talk about this new program that people are going to be trained on, and I forgot what it was called. It was
Prep mod.
Prep mod.
Prep mod. What became of that? I haven't heard anything about that today.
Sure. Thanks for the question. So in the interim, the call center process with the manual offline booking that we're assisting the health district with is the current solution instead of using the public interface of VAMs. So that is how we're focusing and making sure that if you're on our wait list, even if you're one of the situations where you were only able to register once because you have one email address, we're able to work through that and make sure you get booked based on your priority group and then your timestamp on the wait list. Our understanding is that Prep Mod is still coming. I believe that there was some personnel from Richmond coming up to the district this week to offer training to the health district staff. It sounds like there is a head of household model in Prep Mod where one person with one email address would be able to register a spouse or dependent children in that model, and so it does alleviate some of those email concerns with the new system, but they've not received the formal training yet, so we need to wait and check with our health district colleagues to confirm the improvements. But in the meantime, the manual offline booking process that we're supporting them with is making sure that we don't run into any of those email address challenges until Prep Mod's fully online.
Okay, and I'm sorry, I lied. I got one more question. Is there a website right now that people can go to check and see where they are in the queue? Is there, and I apologize if somebody else asked that already.
So there is no website. The data can't be publicly accessible because it is personally identifying information. We are going to speak with our colleagues in the health district and the cities about that strategy for at least taking the email data and doing an outreach to those folks, letting them know you're still on the list. We are looking at the data and ways to potentially get a little more granular in the future. I'll tell you that based on where the data is right now, because of how it was collected in the early days of the wait list, it at times lacks some of the essential group attributes, and so we don't have a complete concrete data set of a record being 75 plus, 65 to 74, 16 to 64 with medical conditions, or the various priority groups on that chart. But we're working through the various options of trying to get as complete of a picture so that we can do more stratification within a group. And I'll just also offer and remind that the state is moving to a statewide wait list. They have said that they will take all the wait list data from the local health districts, and the timestamps that the local health districts have will prevail in the state system. And that's all going to come into play next week. So there's a lot of question marks in the air about what that looks like moving forward.
I don't remember who was next.
I was next.
Thank you. Yes, I thought it was to my right, but yes, it was Supervisor Vega, then Supervisor, have you already asked a question, Supervisor Bodie? Is it, well, perhaps people before you. Thank you.
Brian, how are we monitoring the call wait at the center?
So that's a process that our scheduling branch director in the EOC keeps an eye on throughout the day, as well as the supervisors in the call center. There's a real-time dashboard that lets them see the number of agents logged in, the wait time for each queue, and then we also have a service level metric of making sure everything's answered within 60 seconds. They are able to shift staff amongst the various queues, and for the majority of the week, we have not seen significant hold times. Most calls have been immediately answered by an operator.
So do we have an average?
We are working on a dashboard of that data. I can try to run some numbers and get something for you manually, and then we're working toward that dashboard hopefully for next week or the week after.
I'd appreciate that. Thank you. My next question, I've received some emails from constituents where they've been successful at getting their first dose, and they were unsuccessful, though, in signing up for the second. When they did receive an email from the health district to sign up, they were notified that there were no spots available. Is the public still to go ahead and call? Or what is the best way to go ahead and sign up to try to get the second dose?
Yeah, thank you for that question, Supervisor Vega. So that is unfortunately some of the confusion caused by this VAM system. So there are some folks that started out in VAMs with their first dose, but there are no second doses available anywhere in the region for them to sign up for. Unfortunately, the CDC, as part of that system, has some very persistent reminders. So it keeps nagging them to go sign up and schedule, and they log in and there's nothing there. So what we would ask is that if someone finds themselves in that position, to go ahead and contact the call center, let them know that they had their first dose scheduled in VAMs and they are not able to find a second dose, and they will put that person into the second dose pre-registration process. That process only books out folks who are overdue or due within the next 7 days, because we're still in that process of trying to balance out the data of all the appointments were free-for-all initially. There was no delineation between first or second doses in that system. So as folks do come up in that situation, the call center is accommodating them. And when I looked at the data this morning, I believe we were booked up on second doses through the 11th, and they were starting to look toward the next week. Okay.
And my last question is, in terms of population, is Prince William County where it needs to be in terms of vaccines allotted to our county?
We have not received, and I don't believe the health district has received their allocation for the coming week, but our understanding is that it's still being met on a per capita basis.
Okay. Thank you.
Mr. Martino,
Yes, ma'am.
your light is lit. I
Oh,
didn't
I'm
know whether
sorry.
you want to speak. Okay, I'll go to Supervisor Angry or Supervisor Candler, and then go back to Supervisor Bodie.
Thank you, Madam Chair. I do have a few questions. Can you hear me?
We hear you, sir.
Yes, we can. Thank you.
All right. Hey, Mr. Miser, thanks a lot again, too, for these updates. To the COVID testing, just a question real quick. Have you guys given consideration to mobilizing and moving that the COVID testing? To my point, if there is a church and a congregation all wants to get together and get tested COVID, because you said right now the numbers are going down of testing, so you move it down to a couple of days, you're still giving 200 doses. You know, have you given consideration to moving to locations where maybe the communities and the different groups will get together to allow you to get that 200 out and still do this contact tracing and get people to stay at home and all that good stuff?
Thanks for the question, Supervisor Angry. So the existing sites are the same sites that we rotate through. There is flexibility to pick one of those sites per week to be a mobile event. That's not one of the same fixed locations. So if there's a specific part of the community that has that request or need, they can work through us with the partner request form, and we'll work with Chief Smolsky, our testing task force leader, to try to accommodate that request.
Okay. Yeah, I don't know any particular. It was just a thought I had. And to that point too, you know, now labs have gotten better at the lab results, and there are a lot of different organizations that do COVID-19 testing now. I know you used to have to vet them all, but have you given consideration of working with other COVID testing agencies that could possibly do the test? You know, alleviate you all, because I know you have a huge population right now doing vaccination, which is our highest priority right now. But still, I don't want to lose sight of COVID testing and the fact that we have some super high numbers and a strand of virus that's even worse than the first.
Yeah, thanks for the question, sir. So we are working with our other partners in the region to learn from their experiences with some of the additional testing capacity and looking at a couple of options that might allow for the private sector to take a more active role. We hope to have an update for you on that here in the next few meetings.
Okay, I appreciate that. And then here's a simple question. I don't know if anyone's ever asked this question, and even if you know the answer to this. If you have COVID-19, can you get a vaccine shot?
That's a good question. I do know that if you are currently symptomatic or if you are on quarantine from an order from the health district, you should not come to your vaccine appointment. There is some criteria that they will work through with you on the call center if you call with that situation about rescheduling. I believe the guidance was it needs to be at least 14 days from when you were out of quarantine or confirmed to be positive. And if folks have additional questions, they can reach out to the call center and get their questions answered.
Okay, and then just two quick, Madam Chair, just two last quick ones. What do you know, before I ask that question, now I'll jump it together to tie them together. You know, we're gonna run out of vaccination shot, the vaccine. We're definitely gonna run out before there's a new influx because there was no reserve. So I don't know what you know about that and what that looks like. But then to that same comment is, do you know anything about Johnson & Johnson and where they are with their vaccine? Because once that's released, that's going to be a huge boost for really America and definitely Prince William County.
Sure. So to your questions, I'll do the second first. The strategy is that the health district will work with us and the partners in the city to determine the number of appointments that will be made available based on the supply they're going to receive for each week. So we're already in that leaning forward process of more actual stations where someone can be seated and working with a healthcare professional to get their injection will be available than there are doses to accommodate that full capacity of that site. So if we do suddenly get an influx, the capacity's there. And the vaccinators are contracted on standby or in training as we speak to meet that increased capacity. So it's a capacity management in terms of we're not overextending the amount of appointments so that we don't have to cancel someone if there should be a weather delay from a vaccine shipment not showing up on a Monday, for example. To your other question, all we know is that Johnson & Johnson has applied to the FDA for emergency use authorization. I've not heard that it's actually been scheduled on the docket to be heard. I've just seen in the media that they are leaning forward with production. So hopefully we'll be in a similar situation where once the EUA is received and affirmed by the CDC panel that have to affirm that there is an inventory ready to go. And we continue to lean forward on those plans as to how we might be able to use that inventory as soon as the Richmond folks tell the health district how much of it they're going to get.
Okay. Hey, thank you. And Madam Chair, just lastly, I definitely support Supervisor Franklin in looking into how did the federal and state come up with just one CVS location on the western end of the county. Not that it's not a great location for it, but just how did we not look at the numbers and then kind of make that map? So I support us looking into that.
I'm sure we can get some answers on that. Supervisor Kinlan.
Thank you, Madam Chair. Appreciate it. I want to talk about clinical capacity a bit. Right now, the presentation talks about clinical capacity of 5160. Do you want to talk a little bit about what that means?
Sure. So that means that across the Beacon Hall and the Potomac Middle School clinics that are available for scheduling, there is a combined capacity of 5,160 appointments to be scheduled. From the last update I saw, we were nearly full on that. We did briefly pause some of Thursday due to weather plans, and that's part of about what we're to discuss with our colleagues in the city and the health district to make sure we are able to reaccommodate folks without having to cancel anyone.
Okay, so let me make sure I understand this. When you say 5160 to be scheduled, that means 5160 to receive the vaccine.
That's correct. That's correct.
The capacity to give out vaccines.
Correct, sir. And I would note that the Beacon Hall capacity that's noted as being in VAMS has been booked for weeks. So those were appointments that were booked long ago. Potomac Middle School was added recently. A small portion of that is in VAMS for the second dose situation, and then the remaining is that offline capacity that we're booking from the call center and the wait list.
So does the 5160 include both the first and the second doses?
Yes, sir. And unfortunately, because of the VAMS data, it did not differentiate between when those folks actually made their appointments.
Yeah, and so I heard Mr. Martino talk about plans that are on the table right now. The issue is that really two main issues. It's how many vaccines we get, and then what's our capacity to deliver those vaccines. Currently at 5160, with the 49,000 people who are on the waiting list to get their first dose, that means they need to get a second dose. We've got about another 9,000 that are on the waiting list to get their second doses. That's over 100,000 people right now who need to get a dose of the vaccine. And at a clinical capacity of 5,100 and some change a week, we're looking at about 5 months to burn through just the folks who are registered today. Now I believe those numbers are correct and my math works. I guess my question is do we have plans? What do the plans look like to double or triple that clinical capacity? Because like I said, the folks that are on the books right now are just the folks in that 1A and just a few ones in that 1A. Folks like myself who aren't in any of those specialized groups, we're looking to fall, maybe late fall before I have an opportunity to get the vaccine.
So let me answer that, break it down two different ways. Just the one thing to briefly note is that the combined wait list, so the first dose wait list is 48,899 people, and then the second dose pre-registration is 8,839 people. So to the point of the capacity to put up to 5,160 doses in arms each week, that's still dependent on supply, and the average Moderna that they've been receiving and allocating towards that capacity of 5,160 has averaged around 3,000 a week. There was a surge of second dose that was shipped to the district because of a lot of that VAMS confusion last week and the fact that there weren't enough second dose appointments for some of our folks who are coming due this week and next week. So that is why there's a little extra capacity shown there this week. But next week, if nothing changes with capacity, then that may actually be a little bit lower. So to your point of if we're only dealing with Moderna and Pfizer vaccine at the same volume we've been receiving it, then it will be many months until we get through just the folks on the wait list. We can say that 1A is for the most part wrapped up on the wait list, and the call center has been focusing on those in 1B who are in the 65 and older group. Based on the guidance from the state level and from the health director. And those are some of the folks that have been receiving booking calls over the last 48 hours.
So let me be and thank you for that. Let me be a little bit more pointed in my question then. Again, we might have this trickle out of vaccines. I think at some point we're going to see the spigot turn on, especially if we get a Johnson & Johnson approved. And so I want to know, what are the plans that we have or the Prince William Health District has to be able to double or triple that capacity if that situation arises? What I don't want to have happen is a situation where we see a flood of vaccines coming to the Prince William Health District and we don't have a good plan in place on being able to distribute 3 times as many vaccines as we have right now.
Yes, sir. Thanks for clarifying. So we continue to plan 50% in advance. So there are a total of, I believe, 12 stations at Beacon and 20 at Potomac. We're working towards having a total of 30 stations east and 30 stations west short term in the month of February. We continue working with other community partners looking at their facilities. We are working with the partners at the state from a data ask that they've had about the perspective of very large facilities should a large volume of one of the single-dose vaccine candidates become available in the next 3 to 6 weeks. So we are actively leaning forward, and that is our goal, is that we will always have 50% more capacity in terms of vaccination stations and vaccinators ready than we foresee vaccine will be available for, so that if we find ourselves in that situation, there is no constraint.
Okay. Thank you, Madam Chair.
Thank you. Supervisor Bodie.
Sure. Thank you, Madam Chair. Thank you again, Brian. Just two final quick questions from me. One, if I remember right, there was supposed to be another location that opened up on Monday, but I know that you guys had to shift some things around because of weather. Is that what happened at that location?
Yes, sir, it is. So we are in the final stages of working on that new facility on the west end. We would like to get the plans finalized to make sure our stakeholders with the health district and the cities are fully apprised and are part of that process. And we also just want to be mindful of the fact that it's going to be booked off the wait list. Many of the partners and facilities have reported frequent occurrences of folks coming, trying to do walk-in, just hopeful that they'll find one of those leftover doses, and we're trying to discourage that because everyone needs to work off of the wait list.
Sure. And very last thing, I just got word that it was apparently that there was a press call or something at 3 o'clock that may illuminate some of the issues that you were talking about earlier. So if we get an update on whatever was discussed in that call, I would appreciate it. Thank you, sir.
Supervisor Bailey, did you have anything? No? Okay. Quick question, Mr. Meisner. Do we have any idea how many vaccines CVS got locally? Do we have any concept?
We'll check on that. I believe the only number that I've seen is the federal allocation to CVS for the week throughout the country for
Right.
the 12 states that they are starting in. So we'll see if we can drill down on it. But
I'm just, more curious, I think. And is it possible that that the federal government pivoted to CVS and Walgreens because they were doing the long-term care facilities and they had that existing sort of relationship going on?
I'm not sure, ma'am. Just from some of the initial reporting from the federal level was talking about getting out into all pockets of communities.
Mm-hmm.
And just to make clear, this is in a very early stage of that program. So there's only a handful of sites in a handful of states. The numbers that they were advertising are quite astonishing in terms of they want this to be a regular thing of, months from now, once the supply is there, it's going to be a regular part of the strategy. It's been part of the Commonwealth strategy as well. It's just been the supply is the constraint.
And one last question. Do we have any data on how many people, especially like the 1As, like the first responders, who are choosing to get vaccinated? I won't say to not get vaccinated, but how many are choosing to get vaccinated? Do we have any data on that?
So unfortunately, we really don't have good data on that in terms of a specific organization or group of folks. There may be some data the health district can offer just in terms of how many doses they've administered to people in that specific priority group of 1A, but because it is voluntary, and even unfortunately due to some limitations with VAMs, when folks were referred to VAMs, they were referred from a specific organizational priority spreadsheet, but once they found their way into VAMs, the only thing that carried from that spreadsheet was first name, last name, email address.
Okay.
So
Just-
there's not much
yeah,
data that's useful, unfortunately.
Okay. Thank you
Madam
very
Chair.
much. Supervisor Canlon.
Thank you. Just one quick question. I know there's been some national data on this and some national discussion and local discussion. Has there, from the Prince William Health District, has there been any demographic information obtained on the folks who have received the vaccines? I know it has been a big discussion on our board about making sure that the minority communities have access to the vaccine. Do we have any sort of data on that, on which folks have gotten the vaccine so far?
Thanks, Supervisor Camlin. So the two data points that we're aware of is that after a dose has actually been administered, if the provider is collecting race and ethnicity information, it is supposed to be uploaded with that individual's record in the Virginia Immunization Information System. In terms of the wait list, at the request of the state, the health district asked us to also add those questions into the wait list for them, and we did so last week. So it is being collected from this point forward on the wait list. But the best source is likely going to be that VIIS data, which only occurs after a vaccination has actually been administered.
So you're saying that when you sign up right now, it asks that question, and but if you don't, it's collected at the vaccination point?
Yes, sir. So for the folks who are being served from earlier priority groups or are already in the scheduling process, it is also it's the state's intention that it's also being collected at the point of vaccination and placed into their authoritative system of immunization records.
And do we have visibility into those records?
I believe there's a state dashboard, however, it is state level only. That is unfortunately a shortcoming of all those dashboards at the moment, is they are state level data only, and it's not possible for us to drill down into the health district level.
Is that something that we can request from the state to get, have them provide a report on Prince William Health District?
I have requested that from a state forum today for these types of requests. We will continue asking the health district to amplify it through their channels, and we're hopeful that the state might be able to make that data more granular moving forward.
All right, thank you, Madam Chair.
Thank you, Mr. Meisner. I know your call's already started. I saw Ms. Kitzmiller run out to probably cover that, so thank you. Thank you for information, and I know the Emergency Operation Liaison is always available to ask questions of also if people need information, so thank you.
Yes, ma'am. Thank you.